Hi, I'm Dr. Sam Bunting. Today I'm asking the question that I hear all the time from patients. Am I too young for Botox? Now, Botox or botulinum toxin injections, whatever you want to call them, are the most popular non-surgical anti-aging treatment in the UK and in the US, and for good reason. It does a very specific thing. But the question is, when is the right time to start thinking about having treatment? I think for a lot of women, the problem is they're influenced by external things, who's having Botox in the media, what their girlfriends are doing. And if you go along those principles, you're probably not acting on the right information. So here's what I do when a young patient asks me, am I ready for Botox? I have a look at their face, both at rest, so when they're sitting without any facial expression, and then I have a conversation with them. And I always look at a face and I try to work out, is there something that's distracting my eye? Whenever we look at someone, we should be focused on the golden triangle between the eyes and the mouth. So the time to think about doing something, perhaps in terms of injectables, is when that's not happening. So the key areas for treating the face with Botox that we know are tried and tested are for the glabellar lines, which create the lines between the eyebrows, the 11s, which indicate that we're angry or cross. The forehead lines, which are these horizontal ones, which occur whenever we raise our eyebrows. And then the crow's feet, which happen whenever we smile. There are other areas for treating Botox, but typically for somebody who's just starting out, those are the areas we would consider treating. And the time to think about it is, one, when it's distracting, when you're in conversation, and two, when the lines that those facial muscles create start to appear when the face is at rest. Often noticed in bright sunlight, or perhaps in a photograph when you're taken or captured on image in a certain angle. So the crow's feet often when you're side lit. The forehead lines often when you're lit from straight above. And then you decide, are these bothering me? The reality being that if they're present now when your skin is at rest and they're just about visible, it's the time to decide whether you're for or against, because the reality is with continued facial expression, those lines will get deeper. Now, I think that the philosophy of using Botox is to actually try to create a more pleasant, happy, optimistic looking face. What we want to avoid is a situation where the face is giving out emotional cues like frustration or anger whenever we don't realize we're doing it at all. And for a lot of people, chronic frowning, where they adopt a frowning position and the 11s are visible, even when they're sitting quietly contemplating their lovely cup of coffee, makes the world think that they have feelings that they don't. And for a lot of people, that can really cause a disconnect. And I think that's really where Botox comes into its fore, by reducing the tendency to emote in a way that doesn't represent how we're feeling. So that is when you decide if you're thinking about having treatment for your frown lines, so what we call glabellar Botox. The other areas, I think, come down more to personal choice and your own sense of aesthetics. For some people, horizontal lines in the forehead, neither here nor there. Crow's feet lines, which tell us that we're smiley and happy. Again, perhaps a sign that the skin is changing, but not necessarily giving out negativity. Generally speaking, crow's feet make us look happy and smiley. So coming back to the question, at what age is it the right thing to go ahead with Botox? In my experience, the average woman with fair skin that is quite animated will start thinking about whether or not it's for them around the age of 30. Now, there are always going to be exceptions to that rule. Those who have perhaps used sunbeds a lot in their teens may well have those subtle first appearing static lines at the face at rest, in their early 20s. And there'll be other women who don't express so much and they have thicker skin, and maybe they're looking at thinking about Botox late 30s, even early 40s. So it's very much an individual thing. But the two principles I would say are, if the lines are present at rest and they're bothering you now, it's time to perhaps think about it. And if your face is giving out emotional signals that don't resonate with how you feel, Botox might be helpful for you. As a final practical note, I would always urge you to see someone and discuss your treatment and what the options might be for you at a consultation separate to actually having treatment. The reason for this is firstly, to make sure you're on the same page aesthetically as the person treating you, because what one person finds attractive and subtle, someone else might find too much. And secondly, I think it always makes sense to pay for good quality advice. Be suspicious of free consultations because there'll usually be pressure to have treatment there and then. Thanks so much for watching. If you enjoyed, please subscribe and do leave your comments down below. Bye for now.